So, do catheterization. I'm gonna walk in, introduce myself. Hi, my name is Tony Nato. I'm a Cedarville University nursing student. Can you go ahead and tell me your name? Perfect. All right. So names match up. I'm gonna provide privacy as I've done. I washed my hands before I came in the room. I've checked the doctor's orders. I'm gonna go ahead and explain the procedure. This is just catheterization. All right. I'm gonna put a catheter in. Should take maybe 10 minutes. No longer than that. If you have any questions or any concerns, please feel free to let me know. All right. I'm gonna raise the bed to a comfortable working height. I've gathered the supplies before I walked in. And also, I would put gloves on and apply perineal care as needed, but for the sake of this demonstration, we'll say that that's already been done. Alright, so we've done the perineal care. We're going to go ahead and set the patient in dorsal recumbent. I've, yeah. Alright. Oh, and I would have washed my hands after applying perineal care. Alright, so that's there. I've washed my hands after perineal care. I'm ready to go ahead and open up the sterile field. First thing, I'm going to apply the sterile pad under the buttocks. Normally, I have an assistant helping me to lift the patient, as though I'm by myself, so I will just go ahead. Alright, it's in position. I'm now going to be okay to put on the sterile gloves. I noticed that this glove has a tear in it, so in a normal situation I would go ahead and get a new pack of sterile gloves, but for the demonstration I'm just going to move on. Alright, so that's done. So now we're ready to prepare the sterile field. Syringe be filled with 5 to 10 milliliters of water. Take the pack like this. Beta and sauce, put those there. Take lubrication. I would collect a specimen per doctor's orders if I need to. So put the lubrication in there. Done with this, you can come back here. Drop that in there. Alright, and now the syringe has been filled. Okay, so now I'm going to break sterile technique on my non-dominant hand by labia, holding that open. Take one, so I'm going to start the farthest one away, swab, drop it in. Then I will go closest to me. Drop it in. And normally I would hold this open the entire time. I know closing it is not good. Take this, go down the middle, drop it in. And now I'm ready to go ahead and apply the catheter. Alright, so female, sorry. Go in, we can go ahead and apply the catheter. You should not feel any pain. We'll just go ahead. I'm making sure not to touch the labia with my gloves. Very sterile technique. So I'll put this in about 2 to 3 inches, so I get urine flashback feedback, and then I put it in about another inch or two. Alright, so got your flashback, went in another inch or two. I'm going to close the labia and hold on to this with my non-dominant hand, and with my dominant hand apply the syringe. Fill the balloon, okay. Detach that. Make sure that there's no pain or discomfort, and pull this out, feel the resistance. Good, alright. So now I can go ahead, hang this bag. Oh, first actually, I will go ahead and put this on, secure it around the leg. Alright, so the catheter is now in. Dispose of all, discard of all this. Cover the patient back up. I would lower the bed, and so for catheter maintenance, I'm going to make sure to keep the bag below level of the bladder. I'm going to empty the catheter every 8 hours. I'm going to provide care every 8 hours. I'm going to encourage fluids. I'm going to maintain a closed system. I'm going to monitor intake and output, and I'm going to make sure to observe the catheter site and make sure that that doesn't get infected or anything like that. And yeah, all right. So would have returned her from North Carolina. All right. So now we've got the doctor's orders ready to come take the catheter out. Yay. All right, ma'am, your catheter's coming out today again. Check doctor's orders. Come in, introduce myself. I would have taken these sterile gloves off, thrown them away. So now I've come back to take it out, wash the hands, apply new gloves. Now, go ahead and apply the padding under the bed. All right, you ready to get this out today, ma'am?
One bottle of normal saline solution.
Go ahead and take this off.
I would check doctor's orders before doing this, making sure it's all right. Hello, Mr. Jones, I'm back. I'm going to be washing up your trach here. Yeah, all nice and clean.
All right.
Yeah, no, every time I look over, you also.
All right, so we're gonna go ahead and pull that out. Make sure to cup it there. Good. Take this, dispose of this along with the gloves. Would apply, wash my hands, hand sanitize, apply new gloves, apply the perineal care as necessary with the new gloves on. Go ahead, take this off. Return the patient to normal. Cover the patient back up. Make sure, and lower the bed back down.